Thanks so much. I'm going to actually take you all the way back to my childhood very quickly to answer this question because I think it's really formative when we think about engaging in policy and advocacy for your health. So I grew up in a very small town and everyone kind of came together to get things done. Everyone was involved in the local community and government. And I took that into the rest of my life and ended up working in politics on Capitol Hill for moderate Republicans. But way back then, there was a desire and a duty to really work across aisles to make sure that the right policy was going to be implemented to help people. And so I sort of learned through the years of both growing up and growing up professionally that if you really want to make change, you can build coalitions and consensus to really do the right thing. And that's really central to everything that we do at the Society for Women's Health Research. And I think it's a really exciting part of the coalition itself. How can we help amplify communities and share our expertise and really support one another to actually make the change that needs to happen? So rather than one person or organization doing it alone, we can all work together to really move the needle forward. One of the issues that we see when it comes to cognitive function and brain health is this idea that it's completely separate from the rest of your healthcare journey. And we also know that there are differences between men and women when it comes to your brain. I mean, I think all you have to do is ask a woman if she's married to a man, if there are differences in their brains, and she would say yes, of course. But I do think, on a serious note, one of the things that we appreciate that the coalition is working to do is to not only reduce the stigma when it comes to women's brain health, but to also better educate women, right? This idea that your cognitive function, whether it's, the risk of Alzheimer's or dementia, is something that you can't change, is one that I think is pretty prevalent. And so the more that we can kind of come together as a community to make sure that we're better educating women, their partners, their families, their children, and as well as policymakers to really think about what are the things that we can actually do to make a difference here and better integrate brain health into this much broader picture of whole health is going to be really important. And I think that the coalition's goals really align nicely with that. There's a lot of noise right now in particular, although I guess this could probably be said for every year that there's a lot of noise in Washington and a lot of different communities that are advocating for whatever their priority is. And so when it comes to health and healthcare, there's a lot of different, not competing interests, but many voices. And that could be in the healthcare system, that could be in the payer space, clinicians, researchers and patients. And there's lots of different issues within those areas that are important. On the women's health side, I think we're seeing a lot of conversation around things like maternal health and uterine fibroids and fertility, but we're also seeing this much broader conversation surrounding chronic conditions and healthy aging. And that's where I think the broader conversation surrounding brain health really fits in nicely. And there's life stages that I mentioned. So things surrounding maternal health, pregnancy, fertility, even through menopause. Brain health is important to women during those life stages. And so really taking, again, a holistic approach to think about how we can change policy and join in on the conversation. So if we're having a conversation about women's health, we have to make the case that the brain is just as important as everything else and make sure that we're looking at it holistically. There are barriers, I think, across the board when it comes to policy. Some of it is unrelated to actual healthcare policy, things like Congress maybe not being able to continue the funding cycle as it should, which usually takes precedent. And we just saw a large conversation and debate surrounding some Medicaid policy and tax policy that needed to get done. And so when we think about women's health specifically and the policy changes that need to take effect, there's just a lot happening that we need to make sure we're engaged in. So one thing that is a barrier is I think this idea that it's a fatalistic issue. So, when you think about Alzheimer's and dementia, women, clinicians, policymakers, everybody probably has an experience with this issue, but they may also believe that there's not a lot that can be done for it. And so they may not be able to make the connection directly between policies that can change, whether that's research policy, tax policy, coverage, access to care, all of these different facets of healthcare policy. Actually, there is a lot that can be done, but I think the biggest barrier right now is this perception that there's not a lot that you can do, and does anybody really want to know if they're at greater risk of developing Alzheimer's or dementia? And I would argue that yes, there is a lot to be done, and we need to be having this conversation earlier, and that actually this is the perfect time to be engaging in the policy conversation so that we can get a holistic approach to change. There are so many gaps across the board when it comes to women's health, and some of it is related to the infrastructure, if you will, when you think about how research is conducted. So, number one, although it is encouraged that researchers should consider that there are sex differences when they're conducting their research, all they have to do is say that they considered it. And so, they're not taught that they should be looking at sex differences. They're not taught that, maybe they need to analyze the data related to male versus female. And so that's a huge challenge, I think, when we think about looking at specifically female brain health. But also, when you are looking at those sex differences, you're able to glean a lot from the information that you gain, and you can actually make change for the men as well. And so it's really important to look at that. So I think that's one big gap when you think about the research. And the other piece is dollars, quite frankly. So when we look at federal dollars or private investment, it does not matter where the money is coming from. It's just not enough to make sure that research projects are getting across the finish line to be continued. A lot of these research projects, particularly when you're thinking about something like brain health, they're longer term than what you might normally think of as a research project of 5 years. You probably need to follow people for much longer than that, and that requires more money. So we definitely are experiencing a challenge, not just in the infrastructure of how research is conducted and what questions are being asked, but also on that funding side to make sure that there are enough resources to answer those important questions that we have. We have a lot of examples of how sex differences is important. And so one of them is in brain health. And some of this comes back to understanding that two-thirds of Alzheimer's disease patients are women, although we don't necessarily understand why yet. So we know that we need to drive more research in that direction to understand what the answers are to those questions. So I think that's one piece. The other piece is really thinking about what we have witnessed over the past couple of years in terms of the attention that women's health research has gotten, both at the national level and the global level. There are a lot more dollars going into it. Both federally, we saw last year almost $1 billion of new investment in women's health research, which is really exciting. We saw that across the lifespan, and Alzheimer's disease and dementia were specifically called out as part of that and a good example of why we need to know more. But we're also seeing private philanthropic foundations putting money into this. So the more we can answer these questions through the research, the better we'll be able to provide the care, the coverage, the access to treatments, and ultimately prevent it. So the research will drive the policy. I think we're still in this place with women's health generally. Women weren't included in clinical trials until 1993 in the US. And so we're pretty far behind when it comes to fully understanding what pathophysiology of diseases, how we can best treat women, and what is age, hormones, all of those things. So we're so far behind that we're just getting to this place where we will be able to see the fruits of that labor and coming into where that research can drive the policy. I think we're getting there, and we're definitely seeing the investment, but at this point in time we're excited to see what's on the horizon. women, in addition to being disproportionately impacted by Alzheimer's disease, also serve as 80% of the caregivers across the country. And that's unpaid in most cases, although we do also make up most of the paid caregivers as well. And so when you think about women who are bearing the burden of caregiving, making these decisions, whether it's for aging parents or children, and in many cases, both, we really need to think about how policy can help support them. So there's a few different ways that this can be done. There are lots of tax policies that are being proposed, whether that's a tax credit or additional incentives for women who are serving as caregivers, but that is not their job, right? That's not their main source of income. The other piece is an employment policy. So not, like federal policy with a big P, but employers can come in and help support their employees who also have this role. And we've seen some large employers start to do that, whether that's protected time off, additional paid leave, things like that, that allows them to go to doctor's appointments with their loved ones or whatever that looks like. I think there's lots of ways to get to this, so that women are not getting burned out or being forced to leave their jobs or not able to care for other folks in their lives or themselves while they're trying to do this unpaid caregiving job that they have taken on. And quite frankly, we need them in society to continue to do that because we don't have the infrastructure to support the population. So I think there's lots of different things that can be done, both at the federal level, also at the employer level. And then I'm sure there are also state level incentives that can be looked at as well, as you think about sort of where folks live, whether they live in rural areas and might need additional support or transportation support, like whatever that looks like, and making sure that the patient is having access to their care and they are being cared for on the family side. I think the most rewarding part is actually seeing change happen. So I mentioned, and this is us standing on the shoulders of, decades of women doing this work and laying the groundwork. So really thinking about that $1 billion in new federal investment, the attention that women's health is getting in the private sector right now. We have just fairly recently heard of several large philanthropic investments globally related to women's health and research, and people using words like menopause or autoimmune disease or Alzheimer's when it comes to women's health more than ever before. So being able to actually see, okay, we have been saying this for 35 years at SWHR, and now we really are seeing more people join the conversation, want to do something about it, and then actually taking that advocacy into action has been really exciting. My best advice is to think of yourself as an expert, because you are. If you have a family member or you are a woman and you are a patient or have interacted with a healthcare system, you are an expert, and trust that. And just pick up the phone and make those calls. You know yourself best and your experience. And so to be able to share that with policymakers is really critical. They need to hear it from the boots on the ground. And so we often do find that I sat in a room fairly recently with a lot of women who were very high profile, and most of them started their introductions with, I am no expert, but. And so that really gave me pause, because we really do know our experience the best. And so it's really important to share that, because otherwise folks won't know, or they're only going to be hearing, from one particular perspective. And you want to make sure to give them a well rounded idea of what their constituents are experiencing. I'm very hopeful by the fact that this conversation is even happening right now, and that people are using brain health, Alzheimer's disease, and dementia as prime examples of women's health and the need for additional research. I don't think that's where the conversation was even just a few years ago. And so I do believe that the number of voices is indicative of a big change coming.